Hi, everyone, and welcome. My name is Preeti George, and I am the project director for SAMHSA's National Training and Technical Assistance Center for Early Serious Mental Illness, also known as the ESMI TTA Center. So we are so pleased to welcome you to our webinar on the role of peer specialists in early serious mental illness programs. I know people are probably logging in, so I'll just let people get through the login pieces, just a minute or so, and then we'll move forward shortly. Okay, I think we can start as people are logging in. We'll just do some introductions and housekeeping. So this is our disclaimer that the views, opinions, and content that are expressed in this presentation do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So we have a few housekeeping notes before we get started. This presentation is being recorded, and during the presentation, you are welcome to submit any questions and comments through the chat and through the Q&A. We will be making the presentation slides available afterwards via email. And also, you'll notice we have a number of individuals who have the name ESMI TTA Center in their names. You can reach out to them if you have any questions or need any assistance throughout the webinar. So for our webinar today, we'll start with some introductions for our speakers. Then we'll go through the presentation itself, and we'll follow that up with some question and answer sections and some closing remarks to follow. Okay, so I am so pleased to introduce today's speakers. Vanessa Klodnik is a research associate professor at the Texas Institute for Excellence in Mental Health, Steve Hicks School of Social Work at the University of Texas at Austin. She is an expert in multidisciplinary team-based care for young people with serious mental health diagnoses, including early psychosis. And she partners with states and agencies to better understand and improve implementation of youth and young adult peer support. We also have Brianne LaPalooza. She's a senior administrative coordinator at the Texas Institute for Excellence in Mental Health at the Steve Hicks School of Social Work at the University of Texas at Austin. Bree is a writer, researcher, and expert in knowledge translation. She's co-authored several publications, practice tools, and manuals focused on youth and young adult peer support. She's developed and delivered trainings and presentations about peer support philosophy and practice to national and international audiences. Bree applies her lived experience perspective and years of experience working as a peer support specialist to her role as a trainer. I'm so pleased to welcome our speakers. So I'm going to turn it over to you, Vanessa.
Hey everyone, I love the hot chat box. Keep it coming. It's so great to see where everyone's from across the country, and I see we have lots of peer specialists who are joining us. So hello everyone. Today we're going to describe the role of peer specialists as part of early serious mental illness or ESMI teams. I'm going to use that acronym. We're going to identify some philosophies and practices that peer specialists employ when they're working with young people on ESMI teams and also with their team members. And what I think is most important, and I hope that y'all take away from today's webinar experience, is real strategies, practices that you can apply in your setting to best support peer support providers in your ESMI teams, and to better partner with young people in these peer roles. Our next slide, please. Just really quickly, because I come from the serious mental illness world originally. I've been doing this work for about 20 years, and the peer role is just such an incredibly important role in adult psychiatric rehabilitation for serious mental illness, or SMI. And I thought it was important to kind of provide a foundational slide around, well, what are we talking about? What is early serious mental illness? What is SME? Right now, this is a developing concept, right? We know that there are teams across the country that are dedicated to early screening and identification of young people who are at high risk for psychosis. We know that young people who are showing some distress and some serious symptoms, but might not have the um, deeply impacted functioning with work and school and relationships yet. They might still be doing okay, but they're experiencing a lot of distress. So this concept of early serious mental illness is really important. And it's a newer thing in our approach and our early intervention, and it's all aimed at prevention. And what's so exciting about this is having peer specialists that are integrated in programs and multidisciplinary teams that are engaging and supporting young people with ESMI is incredibly important, both for engaging young people in these service models, as well as supporting young people with their personal goals and their quality of life. Next slide. So Bree.
Hey everyone, I'm Bree. Also very excited to be in a space full of peer specialists and people working in community mental health to talk a little bit about what is lived experience. So, personal knowledge about the world gained through direct firsthand involvement in everyday events rather than through representations constructed by other people. Next. Lived experience specifically refers to those who are directly affected by social, health, public health, or other issues associated with a mental health and/or substance use condition, including their family members, and who have experienced the strategies that aim to address associated challenges. What is peer support? Next. Offering and receiving help based on shared understanding, respect, and mutual empowerment between people in similar situations. I actually really like this definition especially that it includes respect and mutuality between people. That is not always given in like a formal definition of lived experience or peer support. So I like that. Next, please. As I said, peer support is rooted in mutuality, which is a behavior in which two or more people or groups feel the same emotion or do the same thing to or for each other. Next. Informal or natural peer support is common. Consider when you felt that someone got you or really got or understood someone else and what that felt like. So we can all understand what that means. So there's this definition of peer support as a formal practice, discipline, thing to understand, thing to do. And there's peer support as something that naturally occurs in our daily lives. And these things are not completely separate, they inform each other. Next slide.
You know what's interesting about that feeling just understood is this notion of conditional regard, where you just, when you're with someone, you just feel like they get you and you get them. And that's a really special experience, that deep connection. And so peer support inherently is rooted in that connection. But what we know about formal peer support, it is a non-clinical practice. It is a profession that has grown out of the peer movement following deinstitutionalization from psychiatric hospitals into community mental health treatment in the 70s. Prior to then, we do not see, there are not peer support or peer specialists in mental health treatment settings, but we see this change. We see there's this huge push to professionalize this peer role, to really include folks who have lived experience. And I'm going to use the word expertise, which is something that we talk a lot about. And how do you use your lived expertise in your work as a peer support specialist? And how do you lift it up if you're a team leader or a colleague of a peer support specialist? It's really important that you walk away today. Peer support is not new. It is a practice model with standards, ethics, certifications. We have several links on the bottom, and when we share these slides, y'all can look at these. These are coming out of adult psychiatric rehabilitation, but this is a practice that is well defined, and it is recognized as an evidence-based practice by SAMHSA. Next, click. Also, very importantly, since 2007, y'all, that is a long time ago, that peer support has been recognized by CMS as a Medicaid reimbursable service, right? And so you know you're a real service out there in the world when you can get Medicaid to cover it in community mental health. And for a long time, peer support has been incredibly prominent and important for fostering recovery for folks who are adults in psychiatric rehabilitation programs across the US. What's new and exciting is we see the increasing inclusion of peer support in ESMI programs, programs that are doing early engagement and treatment of these more early serious mental health conditions among adolescents and young adults. Next slide. So here's a slide with a lot of information on it, but I swear I'll explain this in a way that I hope will be very, very helpful to you. This comes from research that Bree and I and our colleague Janet Walker at Portland State University were involved in. And essentially, we set out to better understand in ESMI programs across the US, including transition age youth programs, many that use the TIP model, as well as first episode psychosis programs that were multidisciplinary. We sought to better understand what is peer support practice? How does it work? Right? Like, why does it work? And so our goal was to build a practice theory, which sounds really heady, but hear me out. Our big takeaway from doing small groups or virtual focus groups with young people who were peer support providers on these ESMI teams, as well as young people who participated in peer support on these ESMI teams, what we learned is that there's something really special about that connection. And we call this the peerness-based relationship. And it's this crucial part of peer support. And if you don't get it, if you don't develop it and sustain it, peer support won't work. It's about that foundational, deep connection. So on the left-hand side of this diagram, the way a peerness-based relationship is promoted or created, it's done through by having two people who have shared experience of identity, far beyond, as Bree said earlier, just having a mental health diagnosis or having experienced mental health treatment. It's far beyond that. It's having a deep connection in shared identity, shared interests, shared goals. Also, what we found, this age cohort piece was really important. Being nearer in age was valued. Now, it's a qualitative study. We've got a lot more research to do, but we know there's something about being younger and knowing that someone who's younger gets you and has gone through similar things and has similar goals and interests. That matters. So it's this feeling that this person's similar to you and you have this connection and it's a mutual connection. And then it's this interpersonal approach that a peer support or peer specialist uses that is not coercive. So a peer support specialist is not trying to get a young person to think or act in a specific way. They're really focused on getting that young person to open up and share their ideas and share their perspectives on what they're working on together. The peer specialist is non-judgmental and curious, is always leaning into curiosity, right? And really trying to understand how and why and get the young person to reflect on that and gain greater self-awareness through doing so. Also, the peer specialist uses supported listening and just is providing validation and empathy while listening. I think one of the most, and all the research we've done of peer support and trainings and all learning communities over the last like 19 years, the listening piece of peer support is so important. And so is the unrecognized emotional labor of peer support, which I'm sure we will get into shortly. But also, what's really important as the peer specialist to foster this peerness-based relationship with a young person is real, is authentic, is open, feels real. There's something about that that really matters. And once that relationship is formed, then a young person's like, huh, this peer support specialist is credible. I might trust them. I might take their suggestion. I might do something that maybe I'm afraid of with them. And then on this diagram, a PSU means user, peer support user, essentially when I say young person. So I'm talking about young person comes to feel increased hope, less anxious, right? Feeling more empowered through this peerness-based relationship with their peer specialist. And then they can take action around their goals because they feel supported and secure and they've got this person who's in their corner that really gets them. So then they're trying out things and making movement on their personal goals. And this, in a nutshell, is the theory of practice we developed in peer support and ESMI programs. Bree, do you want to add anything to this? Did I miss anything? Anything that you think is important to emphasize?
Something's not on this diagram, but something we touched on a little bit is that it's not just having a mental health condition in common, even if that is true, or even if there's any type of experience that someone has in common, it doesn't necessarily make a peerness-based relationship, just having that lived experience in common, but also being able to recognize and explore all of the other aspects of a person's self and identity that make them who they are. And both as peer specialists and as peer support users or young people, to be able to really establish a strong foundation for a potential peerness-based relationship. All these aspects of yourself have to be taken into consideration, and that there's not just an assumption that because one thing you have in common with someone makes you relatable to them and vice versa. So I think we can go to the next slide.
Yeah.
So a key takeaway is the most important way to support peer specialists in ESMI programs is to first recognize and understand that peer support is a skilled practice. Peer specialists use their lived experience intentionally to provide support aligned with peer support principles and philosophies. So as I just said, it's not just being friends, it's not just being someone with a mental health history, but it's a skilled practice. Next slide. Nothing about us without us. You may have heard this term before, used in many different ways, but it really is the foundation of peer support. And even the fact that me being a person with lived experience as a peer support specialist is able to participate in trainings, both delivering and receiving trainings has to do with this, but nothing about us without us is foundational to peer support and something that really needs to be integrated into teams and agencies to really understand and support peer practice. Next slide, Vanessa.
We've got some great questions in the chat. I just want to recognize these, and I know our Support Westat team is going to be taking a look at those. We're going to answer Q&A later, but I just want to keep the questions coming. These are fabulous. They're really just great questions. Please keep them coming. So the study that I described earlier, where we developed the peer support practice theory of peer support providers and ESMI programs, is part of the study that produced skills for expanding expertise in peer support. And I do just want to say that this was funded by NIDLR. It's a great funder who supports and loves to support research of folks with lived and living experience and expertise in research. And so this entire project was really developed so that we could deeply understand the peer support role in practice and then figure out strategies to best support the development, the professional development of peer support providers in ESMI teams, which there's trainings out there. There are certain states have trainings across the country. They have certain common elements across the trainings. We could talk about that later if folks are interested. But today, Bree's going to share a little bit about additional findings from this study where we detailed the skills. So we started out with the theory of practice. So how does peer support work? Like, why does it work? And then we asked, well, what are the skills that are incredibly important for a peer specialist and an ESMI team to have to be successful on ESMI teams? So we're going to dive into that. And then we also have developed a training and experience for both peer specialists and team leaders and supervisors of peer support specialists who are also in ESMI teams. And we've also have some findings we could share a little bit about that. But Bree, you can share the skills.
Move on to the next slide. Um, actually move back to the last slide, if you don't mind. Thank you. I just want to add on a little bit to the overview. So as Vanessa mentioned, the SEEP's key skills were developed based on working and lived and living experiences, and were informed by the perspectives of both service recipients and providers. So peer support specialists, supervisors, and clients. The purpose of identifying these skills and related challenges was rooted in the need to better understand and expand peer support by defining the unique traits of it as a skilled practice, the emphasis on expanding expertise. All of these acronyms provides context for growth and enhancement of the role. While ethical guidelines and tools for peer support exist, there's no specific handbook or degree that you can get on how to enter or navigate a clinical space as a peer specialist. This lack of a clear path to professional development for peer specialists compared to colleagues who literally went to school to learn their practice, such as social workers, therapists, etc., leaves a gap in understanding, enhancement, or enshrining of peer work in community support, or CSC, sorry. SEEPS was used as a framework for a series of trainings for both peer specialists and supervisors, professional development for supervisors and colleagues that is focused on peer support lens to increase understanding and enhancement of services. So the skills and inherent challenges with these that we could not capture. Next slide now, please. So here are some of the key skills defined for peer support specialists, expanding expertise. I'll just read through them, then we can discuss a little bit. 1, understand and describe the peer support specialist role. 2, be genuine and draw on personal experience. 3, provide empathy and validation. 4, draw out participants' perspectives, preferences, ideas, and points of view. 5, support personal agency and empowerment. And 6, support motivation and activity. Vanessa, is there anything you wanted to specifically add about the skills?
Yeah, it took us a long time to organize these. And so we had done many, many, many focus groups and trying to figure out what's the best way to categorize all the different activities. People always say, what do peer support specialists do? And it's like, well, a lot of things, a lot of things. But these skills are helpful to take about 25 steps back and to think like, okay, what are the key skills that peer specialists use in their day-to-day on these ESMI teams? And from talking to many peer support specialists on ESMI teams and peer support participants on ESMI teams, these were the 6 that we developed. One of the things is we could not talk about these without talking about how challenging it was to do each of these. And so in our coding and analytic process, it was like, well, yeah, how annoying is it to have to like describe your role every day? And that is number one across all the projects, trainings, things that peer specialist roles are new. They're new in the youth services arena, and that many young people in these peer roles have to say like over and over and over, and they have talking points. Some folks have done a lot of work in Massachusetts. Massachusetts folks, you're doing great work over there. Many peer specialists have taken upon themselves to develop their own education tools for their colleagues, right? So this foundational skill of being able to explain what I do is needed because the field hasn't caught up yet, right? Hasn't caught up. Like many people know what a therapist is, there's a general understanding, but a peer specialist is such a new concept. Then usually that responsibility, unfortunately, like I don't agree with this, is falling on the peer specialist to explain, right? And that's why I really support supervisors. And don't worry, we're going to get to some suggestions of how to best support peer specialists on ESMI teams. But really that supervisor role becomes a major advocate and champion for educating people on the role and what it is and what it isn't.
Okay. So all of these skills may be applicable to what everyone on a team is doing. at face value. Even describing your colleague's job is something that everyone does, but there are also specific challenges and skills related to how a peer support specialist specifically is different in this context, and what support is needed, what are the unique challenges and areas of expertise that peer specialists require. So we just broke down a few of them. We talked about the understand and describe the peer specialist role. What are some of the associated challenges with this? Especially like particularly for peer support specialist role that maybe other roles do not have. So determining how much personal information about being a peer is relevant and comes across as authentic to share when defining yourself as someone with lived experience. Anyone who works as a peer specialist, I know from experience, has likely had a challenge like this and figuring out how to navigate what to share, how much, how is it helpful for the people I'm sharing it with, and how can it be non-harmful to myself as well. Also working with supervisors and colleagues who are unclear about the responsibilities and expertise of the peer specialist role. And this is beyond concerns and issues with just delegation of tasks, or, you know, a lot of times peer specialists are kind of given tasks that maybe aren't aligned with their actual job description, or there's no, you know, guideline for how much case management, for example, should be shifted on to a peer specialist, or whatever it might be given the need and the situation of the team. But also understanding the actual expertise that a peer specialist brings, not just doing the other tasks that all the other clinicians do, but how does a peer specialist bring their own work, their own expertise to their work? Being genuine and drawing on personal experience. So I'm seeing a few things in the chat as well about relating to participants, to young people, or to the people that you work with, your clients, even when you feel like you can't. So there are some, like I said, like Vanessa said, we probably won't get to all of these while we're doing the presentation, but I'm just seeing a lot of people empathizing and asking questions about that. How do you relate to participants when you feel like you can't? And then how can you be genuine about that in a way that is helpful and non-harmful? Talking with participants about their ongoing challenges in a way that is genuine but not distressing. Once again, boundaries and things like that are a skill that peer specialists navigate constantly, but aren't always looked at as being a skilled practice. Providing empathy and validation. Again, unique ways that peer specialists do this in their role. Addressing situations where they do not feel like it's possible for a peer specialist to genuinely understand them. Recognizing when topics are too traumatic or unhelpful to explore with them, and know when to get additional support from other providers. So these are just a few examples of the skills and related challenges. Vanessa, anything to add here?
No, I mean, of course, but no. For the sake of time. Next slide. Oh, do you want to go back one slide?
Yeah,
There you go.
I'll just go through the remainder of the skills and challenges. So, and again, I'm reading the key skill defined here, and then the challenges of this skill. If something was a skill, like to be a skill inherently means that something has to have challenges, or has to be challenging. So it's just kind of breaking down, like Vanessa said, going back 100 steps to really breaking down and looking at, oh, what is the actual skill involved in this, and what are the actual challenges involved in this skill? So drawing out perspectives, preferences, and ideas. Some of the challenges associated are navigating situations in which a participant is reluctant, unwilling, or unable to share their thoughts. Responding carefully when concerned that a participant's ideas may be counterproductive, risky, or harmful. About supporting personal agency and empowerment. Addressing situations in which a lack of power and/or resources poses significant barriers to participants' goals. And recognizing that others, so team, family members, etc., might pressure them into specific treatment or ways of thinking that are not aligned with peer support principles or peer support ethics or ways of non-coercive thinking. And I'm seeing talk about non-coerciveness in the chat quite a bit. Supporting motivation and activity. So managing the desire to persuade people to pursue certain goals or activities when they're not internally motivated. So when people are not internally motivated to do something, it's especially required of a peer support specialist to be able to meet people where they're at and explore rather than coerce or assume an intrinsic motivation that someone might not have. Could be related to pretty much anything. Addressing situations where peer specialist believes that a participant's motivators detract them from their well-being or aspirations is also a challenge associated with this. Next slide.
I wanted to quickly talk a little bit about the Massachusetts Young Adult Peer Mentor Model. Back in about 2015, there was SAMHSA funding that supported the integration of young adult peer mentors or peer specialists across programs that were serving 14 to 21-year-olds. The peer specialists, young adult peer mentors, are aged 18 to 30 approximately, and they have their own lived and living expertise of having a mental health diagnosis and having navigated the Massachusetts mental health system. What is really great about the young adult peer mentor model is that it's been really well defined. We have these 6 clear, they're called the core elements of young adult peer mentoring. These were developed by the young adult peer mentors through a process with a consultant over time. These were probably developed 6 or 7 years ago, and now there's training in Massachusetts, and all young adult peer mentors receive and participate in training to be able to deliver this service line. The first and foremost, I just want to reiterate, and for folks asking questions about this peer role and how it works, that connection, that meaningful peerness-based relationship, that connection, whatever word makes you feel good. I kind of lean into alliance. I like the working alliance as a notion. I'm a clinical social worker by training, and I love all my licensed clinical social workers out there who cringe when we start talking about the relationship. It's like, well, no, it's this deep connection of just feeling seen and known in the struggle, in the real struggle that is having a serious mental health condition and all that goes with it while you're transitioning to adulthood. But that relationship is really foundational in the young adult peer mentor model and in all of the research that we've done with transition age youth peer support models. Also, as Bree just said, and related to the skills in Massachusetts, is supporting young adult vision and goals, right? You're supporting a young person with gaining that self-awareness and understanding, like, what is my priority? What is my preference, right? So young people can advocate for themselves in their team meetings and in the spaces and places they navigate daily. Role modeling. So this is something this has not come out of our mouths yet. However, with the mentoring model, right? So mentoring is a little different than peer support, but this idea that we're role modeling, we're teaching and coaching in the moment. Transition to adulthood is a lot of learning all sorts of things that help young people to move towards greater independence. And so role modeling being really important, key piece of young adult peer mentoring. Demonstrating safe, ethical, and professional behavior, incredibly important, right? And I know folks are mentioning in the chat about, boundaries and whatnot. And this is where it's really can be really tricky about when to share and what to do on the job, or what happens if someone texts you after hours. That's why you usually have a great supervisor, right? That you can get with to talk about what I like to call sticky situations that come up. Also promoting self-care, we actually haven't mentioned. So maintaining your own wellness on the job, which I'm going to say this out loud to many people on this call, but this is not just an individual's responsibility. This is an agency and a system's responsibility to really help staff put their self-care first while they're engaging in emotional labor in our mental health systems. But promoting self-care is really important for young adult peer mentors so that they can be effective in their work. And then finally, having responsive practice, right? Really culturally responsive and aware that you're connecting and respectful for the variety of young people that you're working with. You have different life experiences, different interests, different struggles, right? And so that we're tailoring our support to the needs of young people. There's a ton of training materials. There's these wonderful things called practice profiles. If I have any implementation scientists on this call, you'll go wild when you see this website. Each of these core elements, these practice elements, are defined in a practice profile. It's really quite lovely. Please check them out. Next slide. I also wanted to share some additional resources that Bree and I and colleagues of ours have developed over the years that I think are very, very helpful with supporting, I'm going to say, I don't love this word, but the integration or implementation of peer support and ESMI programs. On the far left-hand side is something I worked with in Massachusetts. It's publicly available. It's an organizational self-assessment for an organization, a team of cross-departmental leaders to get together and answer some questions to guide their implementation and support of youth peer specialists or young adult peer mentors, in this case in Massachusetts. We also have recommendations for strategies for different areas of opportunity that organizations might identify. That's publicly available. Please use it. Please reach out. We'd love to help agencies use that tool. We also have a guide to supervising and developing young adult peer mentors or peer specialists. This is really helpful for supervisors. It's got a lot of self-reflective questions in it that will help you be a better supervisor. In Massachusetts and across the country, many peer support specialists on ESMI teams are supervised by a Big L, a licensed clinical counselor, social worker, or psychologist, and they're not typically supervised by a person who's a peer support specialist. So supervisors really need some training. That's a great exercise, a great guidebook. We also have Effectively Employing Young Adult Peer Providers, a toolkit. This is organizational steps that you can take to best support youth peer providers. This comes out of our work with UMass Transition to Adult Center for Research. They also have great resources on their website as well. And then finally, I wanted to give a shout out to an intervention we developed that is peer delivered and peer supported. It's called CORE. It's a career opportunity readiness experience. It includes experiential workshops that are peer run that help young people prepare for a paid short-term part-time internship so they can gain confidence and competence in entry-level work. But the lived experience component of that intervention is really important because guess what? Young people experience all sorts of social stigma when they have an onset of a serious mental health condition. And so peer support can be a major counteractor to that. And it's really important in our core model. And then finally, because it is arguably the most important practice for engaging your young people, if you're a peer support specialist or not, is integrating virtual best practice, texting and video chat, using it as a supplement to your in-person services. Very, very important. And so this guidebook on the far right has organizational policy guidelines, strategies to integrate text and video chat practice blending, as well as strategies for one-on-one practice and all those wonderful sticky situations that come up. For instance, when you run in to your clients on, an online dating app. All those things can happen and should happen if our young people are engaging in the world and are out there living their lives. And so these are just some helpful resources that are publicly available. We, of course, would love to chat with you all in the future about these and how you can implement them in your organization. Okay, next slide. I'd really like to end with some strategies. We've had several questions in the chat about what can we do to help support this workforce. So first, it's really understanding the peer specialist role from people in the role, all right? Really, really important that we're listening. Ideally in settings, if you have more than one peer support provider in your ESMI programs, maybe you're a one ESMI program next to a bunch of adult teams that have peer support providers, finding ways to get these folks together, really creating communities of learning, reflective supervision groups, any way to get people with lived experience together. And that group can educate others at an agency about what the role is and what it isn't. You also need to understand the peer specialist skills and associated challenges that we reviewed today. We have a paper coming out soon that we'll, of course, we'll share with this community as well that details the skills and challenges that Bree just described. And then finally, specific strategies that I'm going to go through right now for leaders, supervisors of teams, and then non-peer colleagues. Next slide. So first, if you're a system leader or an agency leader and you're like, I love this peer support specialist role. I think this is amazing. I want more. I want to do everything I can to best support this role. First, taking a major step back, ensuring that all agency and or your network staff know what the peer specialist role is. It's got included in new staff orientation, in trainings that all staff get, on the website marketing materials. You'd want to include recovery as a concept here and really educating people on, as I saw in the chat, nothing about us without us. Foundational piece that's moving and arguably disrupting the assess and treat model. And this is a much more relational based approach, that connection that really matters for engaging young people and supporting them during their transition to adulthood. You also want to create an environment that values different perspectives, right? That we're not just valuing clinical perspective or medical perspective of talking about symptoms all the time and distress, that we're also looking at social determinants of health. We're trying to better understand people with different backgrounds, different trainings and expertise. The best way to integrate peer specialists in your program is integrating, of course, other roles as well, right? That we equitably support different disciplines and working together to best support young people with ESMI. Holding town halls, convening network gatherings, any way that you can bring folks together that have different perspectives. A great forum like this is a lovely example where we clearly have folks in the chat coming from different experiences, different training backgrounds, and having lots of questions. This is a space that is really needed and is a good example of this. Another way I've seen at agencies who've done a really good job with implementing peer specialists is having a cross-departmental team. I've actually seen this for transition age youth service implementation as well. Get together folks from across your clinical departments, your IT, your human resources, workforce development, get them together and you meet every month to determine how are we best supporting the implementation of peer specialists and ESMI teams, or how are we best supporting transition age youth programming. Having that monitoring group, that champion group that's cross-departmental can be very helpful. And then finally, creating opportunities for peer specialists to connect regularly, virtually, in person, through trainings, through conferences. If you're a leader, making sure your agency knows about lived experience or expertise-led spaces, places, conferences, trainings, certification opportunities, sharing that, promoting that. If you're a leader saying, hey, folks with lived experience, check out this training offered by the state, you then become a natural champion for the role. Next slide. So what can supervisors and team leaders do to support peer specialists on ESMI teams? First thing is be open-minded. I know you team leaders have a lot going on. It is a hard role. It really is. Program managers too. Hard. It's tough. You're being pulled in a bunch of ways. You're managing up, you're managing down. Be open-minded. If you can, use reflective supervision. Massachusetts is a champion for this. It is a fantastic practice. Use your therapy skills in reflective supervision. I know some of you are cringing right now while I say this, but you all have incredible skills to support your staff. Use them. Reflective supervision comes out of infant mental health. It is a fabulous practice. It uses lots of open-ended questioning. Instead of directing your staff to do things, it pushes you to help them better understand their situation, their reaction, and then plan with you interventions. Share with intention, supervisors. Hey, we all are sharing about ourselves. It's part of who we are. We're human, right? We are who we are through what we say, what we do, how we dress, where we go, right? So think about this. You're a team leader, you're a program manager. Think about the environment, the space that you're cultivating for your team to do the best work, right? Think about how you're bringing your team together and how they're bonding, how they feel connected. Really important that you're also sharing. When you're having a bad day, don't be afraid to be like, man, that really was hard. And peer support isn't always bonding over the hard stuff. It also can be bonding over shared joy as well. So, hey, team leads, program managers, get fun things happening, get your staff bonding. Also, finally, partner with your peer specialists. I've seen some of the larger agencies do a great job with this, where you've got a peer specialist group that's meeting regularly, and they're providing feedback on policy language, website language, job descriptions, all the things. Really incredible if you can do that and really be willing to listen. Try not to say no when peer specialists come to you with that really innovative idea that you're like, wow, that's out of the box. Explore first. How? Why? What would that look like? Better understand before you shut down a cool idea. And finally, last slide. So what can non-peer colleagues do? And I don't know how many folks are on this call, but if you're here and you're a licensed clinical person or you're in a clinical role of sorts and you really don't know what the peer role is, but you really think it's important, you've got a peer specialist on your team, here's what you can do to better partner with peer specialists. Apply this nothing about us without us. Think about if we had that young person and their family member in our every meeting we're in, would we say things the way we're still talking? Right? Our language. When we incorporate people with lived and living experience, it disrupts the way that clinical teams operate. That's the whole point. That's the point of this work, is it's not just about engagement and supporting young people. It's disrupting some of the problematic language that sometimes we can kind of fall into because we're just doing the work. Also, truly value and practice shared decision making. Now, that is a buzzword. I love people like, well, we do shared decision making. I'm always like, well, how? Like, well, what does that look like, right? Because if you take 25 steps back, it's actually really complicated. Who's making what decisions, right? How much is the young person really participating? How can we support the peer specialists in engaging in shared decision making with the full team? How do we support the peer support specialists with helping the young people engage in shared decisioning? So important. Next, practice radical acceptance. This I've already emphasized. When a peer specialist, you're on your team, wants to do something with a youth that you're like, nope, red flags, can't do it. Stop yourself. Stop. Ask for more details. Try to understand why they're suggesting this. Our clinical training only can take us so far. We have a lot to learn from other disciplines. Set your discipline aside and learn from your colleagues. And finally, embrace intentional sharing and mutuality. Don't be afraid to be authentic and be you. All right. You can be you and still be a non-peer. You can also use your lived and living experience intentionally with young people and with families to relate, to colleagues to relate. We shouldn't be afraid of this, right? But for some reason, clinically trained people, they're just taught no disclosure, bad, bad, bad. And we want to step aside from that and we want to celebrate that intentional disclosure with purpose and intent. Disclosure can be very powerful and very meaningful. I'm going to stop here. And I think we're ready for some questions.
We are. Thank you all both so much. We have a lot of really great questions in the chat, so let's get to some of them. One question is, what advice do you have for a program to support a recent client graduate to transition into the peer support specialist role on an ESMI program?
Bree, do you want to take that? It's my favorite.
I don't know about advice, like from that point of view. What do you think, Vanessa? I would say, first of all, I'm assuming they want to do that. They're very interested in that role and they've worked with a peer provider. They've benefited from the relationship, or sometimes there are situations where a team might just think, oh, well, they would be so good at that, but the person hasn't expressed interest, or maybe that type of role doesn't actually align well with their life and their goals. So that is the first thing I would say. And then from there, given that, they are aligned, it's something they're interested in. Maybe Vanessa.
I say get ready because you're going to have to process some stuff, right? So you're watching a transition of a participant client, some settings patient, transitioning into the professional with an equitable role with colleagues, right? Just that shift alone is a shift for the person in the role and for the whole team in their relationships with that person. So this being said, y'all are smart people out there. When you think about transitions, we help our young people through all sorts of transitions, right? Really thinking, okay, how are we going to prepare for this when it gets sticky, which I've seen, my God, I have stories, y'all, lots of stories. It probably will get sticky. I think you expect that and you process when it comes up. And when things get a little uncomfortable and you notice something's happening, oh, so many examples. I don't want to go too in depth on any of them. But when you notice it, I want you, supervisors, I'm telling you, supervisors out there, this is you're needing to watch this. If you're going to promote someone who's coming from a participant client role into a equitable job on the equitable role on the team, you're going to have to be aware of this. So when it gets weird or uncomfortable, you're going to get this. We're going to have some conversations about it. We're going to talk about how we're going to get through this together. I, I'll stop there.
Great. Another question is, are there skills for peer support specialists specifically for those that are on ESMI teams that are unique versus those for other peer support specialists on other types of teams?
That's a really, really good question. There's this, as we mentioned, like this mentoring. So there's a strong practice that exists in some research literature, along with mentoring in youth services, and then peer support in adult services. Adult psychiatric rehabilitation peer support can look very similar and also can be very different. One key difference I see, and this isn't consistent across the country, I've seen it look different ways, but one thing is in adult peer support, some purists are anti-motivational interviewing. No, like see motivational interviewing as coercive. And as we just described earlier, the peer support, peer specialist role is non-coercive. But man, I've trained so many people in peer roles on motivational interviewing, and it can be very, very helpful at times. And so I think there's variety and overlap between peer support, I'm going to say in non-ESMI programs versus ESMI programs. Another thing is advice giving. This is one that gets real sticky too, where for sure I have seen in youth programs people say, well, why don't you just try this? And the young person being like, oh yeah, I never thought about that. Let me go do it, and that's okay. Where an adult peer would be like, I don't give advice, right? And there's still gray area there, right? Like, I don't want to say that it's like, it's only this way or the other way, but those are two areas that right away come to mind. Reed, do you have any thoughts from the work we've done and our experience in the past?
Yeah, I saw motivational interviewing came up a couple times in the questions as well. And well, from my perspective, I do I do feel that motivational interviewing is not inherently appropriate. One of the questions is motivational certification appropriate for peers? It's not inherently um, appropriate or aligned with peer support principles and ethics, but that doesn't mean that there aren't parts of it that are helpful, useful, but I think it's about aligning and understanding peer support work to begin with. You know, if you start with it with motivational interviewing without a clear understanding of peer work as skilled on its own and of the actual outline ethics that SAMHSA and other organizations have created for peer support, then it could be a harmful application. If it's the only thing that you're providing peers with a certification training in, then I would say that shouldn't be the priority, that a peer support specific certification should be a priority. But I think many types of practices and things like that can also be applied and used with discretion, but maybe isn't central to peer support practice itself.
Preeti, can I just add one thing to this? And I'm going to say this, recovery is such an important concept. It is so important. It has changed how community mental health works and operates. And the idea that like, we're not just here to treat symptoms and decrease distress. We are helping people live the life that they want to live in, and it's a process. That being said, and this is beyond the peer role, but for transition age youth teams in general, we have done a lot of research and training around discovery and all the firsts, all the anxiety producing firsts that young people have to do while they're working with us. And so this leaning into discovery and curiosity and making mistakes and learning, I know that happens in adult peer support and adult teams. I know it does. I don't want to say it doesn't, but there's just this heavier emphasis on discovery that I think is really important. You make no assumptions with young people, none, never. But this is beyond the peer support role. This is like team best practices. Make no assumptions. and help young people discover who they are, provide flexible services that allow young people to make decisions and then realize, I don't like that decision. I want to do something else, which is to be expected with this age group. So this age group is just different for practice in general for teams. Sorry, thanks, Preeti. I had to say.
That's very helpful. I think we have time for one more question.
Okay.
The question is, are there ways that families can serve in the peer role? So for example, a family member of an individual with a psychotic disorder who could get trained and help new families understand how to be supportive or helpful.
Yeah, this is beautiful question. There are family peer specialists and family partners in different child mental health systems across the country. Some are in early psychosis programs. For instance, the state of Texas requires that at least a half-time family partner, a family peer specialist, is on a first episode psychosis coordinated specialty care team. These roles, Bree and I conducted interviews with family partners in Texas last year and learned from some of them that were on CSC teams just how challenging that was and how there was tension between the family peer specialist role, because they're there to really advocate for the family's needs, and the peer specialist role, who's really there to advocate for the young person's needs. And so you can just see like the tension there with like then the clinical providers, like, well, they're thinking about symptoms and distress and like stress management and like just the tensions of what's priority on teams. But the family peer specialist role definitely exists. FREDLA is a great organization to look into. There is a national certification. There's an annual conference. Very much is a thing.
Okay, we just have a few more minutes, so we just have a few closing slides to put up real quick as we end our webinar. Thank you both so much. This has been so helpful. On your screen here, you'll see that there's a QR code, and we welcome people's feedback. So if you click on this, you'll be taken to a feedback form to give us information and your impressions about how this webinar went. We'd love to hear your feedback. So we'll put the link to this the website is there. We'll put it in the chat. You can also use the QR code to get to the webinar feedback form, and we would greatly appreciate your feedback. Similarly, we have some additional webinars that are coming up in August and September. There is one on developmentally informed shared decision making. We talked a little bit about that today. So we have a webinar about that on August 12th. You can register now for that webinar. We'll put the link to the registration in the chat as well. We also have a webinar in September about partnering with crisis services and ESMI programs. And finally, we have one on September 10th about suicide prevention best practices for individuals who are at clinical high risk for psychosis or experiencing first episode psychosis. So we have information. If you have any questions, please feel free to reach out to the ESMI TTA Center. We'll be sending out the slides to all of you with the contact information for our wonderful presenters in there. So if you have additional questions, you can feel free to reach out. And we will hope to see you on any future webinars. So thank you both, Bree and Vanessa. This has been fantastic. And we look forward to hearing more about this in the future. So thanks so much.
Thank you all so much for your time.
Yeah, thank you. Have a great rest of your day.